Thyroid? It's a very common disease. Why bother about it? Overweight due to hypothyroid? Don't bother. Cut on the carbohydrates. Don't have rice at night. Have chapatis at night. Ladies and gentlemen, we hear such kind of so many advices when it comes to thyroid. Well, let me tell you that as per a national newspaper, 1 out of every 10 Indians suffer from thyroid. And if not treated properly, if it is not managed properly, if the proper diet is not taken into consideration, then many a times this clinical condition may be fatal and many a times be life-threatening as well. Hi, my name is Subir Singh and I am a certified clinical dietitian, a nutritionist and a life coach. And in today's session, I'm going to walk you through an overview on thyroid, its functions, the various clinical conditions, the signs and symptoms, and the diet advices, where I'm going to talk to you on the do's and don'ts. Because in many case studies, we have found that with proper diet, medication and management under supervision, clinical thyroid conditions have been reversed. So let's get started. Thyroid is a small butter-shaped endocrine gland located at the front of your neck under your skin, and its main function is to secrete two active and inactive hormones called the T3 and T4 with the help of TSH and TRH in your pituitary gland and your hypothalamus. Though it's a small organ, it plays a very important and vital role in the functions of our body. It controls our metabolism, the temperature, the physical and muscle growth, the mental and brain development, the heartbeat rate, the digestion, the calcium metabolism, the phosphate regulation, and so on. There are various types of thyroid clinical conditions like hypothyroidism, hyperthyroidism, thyroiditis, goiter, Graves' diseases, then thyroid nodule, thyroid cancer, and even thyroid stone. But out of all these diseases, the two common clinical conditions are hypothyroidism and hyperthyroidism. Hypothyroidism is a situation where your thyroid gland is not able to produce enough hormones required for your bodily functions. And hyperthyroidism is a symptom and is a situation where your thyroid gland is producing excessive hormones than required. And physicians and medical experts incorporate two ways to do the clinical diagnosis through a blood test or a sonography. Now, if in the blood test your T3 level is normal, your T4 level is normal, and your TSH is high, then it is considered as primary hypothyroidism. And if your T3 is low, T4 is low, and your TSH is high, then it is hypothyroidism. And if your T3 is normal, T4 is normal, and TSH low, then it is called a primary hypothyroidism. Whereas T3, T4 being high and TSH being low, it is termed as hypothyroidism. And of course, we can also analyze it as a pituitary gland abnormality if all the T3, T4 and TSH are low. Some of the signs and symptoms associated with hypothyroidism is fatigue, depression, constipation, weight gain, dry skin and dry hair, muscle weakness, decreased sweating, slow heart rate, elevated cholesterol, pain and stiffness in joints, impaired memory, muscle stiffness, aches, tenderness, hoarseness, puffy sensitive face, feeling cold, and many a times fertility issues and menstrual changes can also be a sign and symptom of hypothyroidism. Some of the most common causes for hypothyroidism is autoimmune diseases, hypothyroidism treatment, thyroid surgery, medication, congenital. It can be because of a pituitary disorder or a temporary hypothyroidism because of pregnancy. And the most common cause of hypothyroidism is iodine deficiency in their diet. Now let's talk about hypothyroidism. Well, the common signs and symptoms of hypothyroidism are unintentional weight loss, increased heartbeat, irregular heartbeat as well, then increased appetite, nervousness, anxiety, irritability, tremor, increased sweating, menstrual pattern changes, increased sensitivity to heat, frequent bowel movement, enlarged thyroid gland, fatigue, muscle weaknesses, difficulty in sleeping, skin thinning, or even brittle hair. If anyone has these symptoms, then it can be an early sign of hypothyroidism. It is advisable to get your blood tested or see a medical expert. Well, what causes hypothyroidism? The most common causes of hypothyroidism is Graves' disease. It can be due to the overactive thyroid nodules, or it may be thyroiditis disorder, or because of the excessive hormonal medicine intake, or it can be because of a pituitary benign tumor, or iodine intake excessiveness might also lead to hypothyroidism. People having hypothyroid condition should avoid certain kind of food. Goitrogenic food like cabbage and broccoli should be avoided because they are found to interfere with how your thyroid would use the iodine. Same is the case with chlorine and fluoride containing water. Studies reveal that there is a strong link between autoimmune thyroid disease and gluten intolerance. So gluten containing food also should be avoided by a person having hypothyroid condition. Now let's take a close look at the preferred diet for people with hypothyroid condition. Well, it is advised that seafood is great for people with hypothyroidism. Seafood like salmon or tuna are a great food apart from the vegetable grown on coastal area. And also it is advisable that lean protein, which is less in saturated fat, is good for hypothyroid condition patients. And then of course selenium rich food, then iodine rich food and tyrosine rich food are also great for hypothyroid people. People with hyperthyroidism should avoid seafood, which was earlier good for hypothyroid patient, and then gluten rich food, soy based food, iodine rich food, and then even dairy food also should be avoided by a person with hyperthyroid condition. Now let's take a look at the advised food for hypothyroid. People having hypothyroid conditions should have a healthy fat food. They should also try to intake cruciferous vegetables and iron rich food, low iodine food, and then selenium, calcium and vitamin D rich food. They all are easily available all around you. Now that we have got a fair idea regarding thyroid, let me tell you that with proper diet and a disciplined lifestyle and proper medication under proper guidance would really help to manage thyroid well, and in many cases it can be even reversed. However, if anyone is on medication, I would urge to them to go for regular checkups and seek medical experts' advice before making any sort of changes. Well, and one more thing, if anyone is on medication related to thyroid issues, they should maintain 1 hour gap between the thyroid pill and the food. And moving forward, also any kind of physical activity, especially yoga, would really help in managing thyroid properly. And yes, last but not the least, supplementation and certain kind of herbs like ashwagandha plays a very vital role in managing thyroid properly and even healing as well. Well, ladies and gentlemen, that's it for now. For any questions, you can always email us to mile2lifescope@gmail.com. If you would like some personalized diet suggestions or solutions, you can always WhatsApp us to 99541 32953. Do like and subscribe our channel, LifeScope World, both on Facebook and YouTube as well. And do share this video if you feel it useful. Thank you.